My name is Joanna Marie Marcos, a third-year nursing student. This PowerPoint presentation is one of the requirements for the subject I am undertaking, Leadership for Beginning Practice. Today, I will be discussing workplace bullying among nurses. What is workplace bullying? According to Australian Human Rights Commission, workplace bullying or harassment can be verbal, physical, emotional, or psychological abuse by a manager or another individual or group of people to a specific person at work. Workplace bullying among nurses has a significant impact on a healthy workplace and patient safety. This table shows the prevalence of workplace bullying reported by nurse professionals. 40% of nursing professionals experience workplace bullying in the past 12 months, while 10% were experiencing bullying on a regular basis like monthly, weekly, or daily over the past 12 months. Researchers explained that a substantial number of nurses end up leaving their first jobs due to their co-workers' negative behaviors, and bullying is likely to trigger the increasing shortage of nurses. A new graduate nurse might consider leaving their profession due to bullying that they experience in their workplace. According to a researcher, workplace bullying can have a profound impact on the nursing profession as it decreases work efficiency, reduces communication, teamwork disturbance, and increases the urge to leave the nursing career due to job strain or burnout. A decrease in work efficiency may negatively influence the experience of a nurse in a healthcare setting. Workplace bullying between nurses not only creates psychological and physical issues, but it also diminishes performance and promotes a negative working atmosphere that adversely affects patient safety. Ensuring patient safety is a registered nurse's duty all the time. Researchers suggested that patient safety could be threatened as patients are at the end of actions taken by nurses. A burnout nurse can potentially make a medication error that can be fatal for a patient. Eventually, the consequences of bullying on the individual, profession, and organization put patient safety at risk for a reason that mistreatment at the workplace can adversely affect the patient's safety. Researchers suggested that to fix the issue of workplace bullying, the healthcare industry must be restructured because the bullying problem cannot be overturned if the attention is on nurse alone. The existing healthcare infrastructure must be resolved to ensure that all healthcare professionals are appreciated and respected equally. Researchers propose that a sponsored organization program of continuing education centered on cultural awareness can generate a favorable culture in the workplace that can end workplace bullying. It is also suggested that health organizations must create a policy about bullying that clearly defines not only behaviors that are unacceptable, but also results that are unacceptable as well. This policy may assist nurses in recognizing what actions are regarded to be bullying, to avoid or prevent them from taking part in this kind of activities, and from helping them know what behavior to report. Researchers added that individuals like nurses must encourage rectifying interpersonal issues, and training opportunities that addresses communication concern must be provided. Workplace bullying is a contemporary topic in nursing practice. Researchers explained that Australia's emerging presence of bullying is illustrated in Australia's latest policies on Nursing and Midwifery Board of Australia. A new code of conduct for nurses has been published by the NMBA effective from 1st of March 2018 that mainly includes a section regarding bullying that clearly states a zero tolerance approach. Effective leadership may contribute to resolving and mitigating workplace bullying by recognizing possible risk factors for bullying within the organization. Having an effective leader will provide an ample concern and dedication to lessen bullying at workplace. Effective leadership can be achieved by regularly consulting staff on their job satisfaction levels and the quality of communication with coworkers. Effective leadership also means that evaluation of existing policies and procedures are done regularly to ensure that the healthcare employees are engaged in respecting one another. As a new graduate nurse, it is our responsibility to maintain a healthy workplace and to ensure patient safety. According to the researchers, it is the nurse's responsibility to ensure patient safety all the time, and patient safety becomes uncertain when their environment transforms to a hostile surrounding due to intimidation between nurses. According to Domain 2 of NMBA, it is expected for a registered nurse to practice safely, effectively, and collaboratively. The NMBA mainly explained in Principle 3.4 that bullying and harassment negatively impact on the well-being of a nurse. This emphasizes not to engage or ignore bullying, recognize the many forms of bullying, act to eliminate, and escalate if suitable retaliation does not occur. One of the standards of registered nurses explained by NMBA that RNs should have a therapeutic and professional kind of relationship among colleagues, mutual trust and respect among nurses, and maintaining a professional relationship must be demonstrated to ensure patient safety and to maintain a healthy workplace. Respect among fellow nurses must be reciprocal. The nursing standards also mention that RNs must provide a safe and quality nursing practice. A safe and quality practice will achieve a desired and positive outcome for a patient. I have referred to relevant research about workplace bullying among nurses. According to the researchers, leadership at certain stages of the health institution, using a proactive and systematic strategy, must be encouraged and involved to avoid workplace bullying. The literature shows the complicated relationship between events and leadership culture in creating and maintaining an atmosphere that allows bullying in the workplace. Addressing workplace bullying is a challenging step, especially for individuals who are experiencing it. Workplace bullying among nurses does not only affect the nurse itself, but especially the patient and their safety. As nurses, it is our responsibility to make a safe environment for the patient. Referring to the literature, further development of policies and procedures that could eradicate workplace bullying is a must. Compliance of the employees in regards to the policies and procedure must be reviewed in a regular basis. A continuing education program addressing cultural awareness can positively impact healthcare workers. The terminologies used to explore the issues surrounding workplace bullying among nurses has been simplified to ensure adequate understanding from the possible audience, like fellow new graduates, senior nurses, nursing students, and other healthcare professionals. The auditory and visual learning experience has been provided to maximize the learning opportunity for the audience of this presentation. Auditory and visual presentation has been used for this learning to reach out to different learning styles of the audience.